There are numberless YouTubes discussing the topic of how long does the dental implant process take. However, the reason that you've come to this educational platform is to learn about the crucial information that nobody else is sharing with you and that is vital so that you can make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience and I've placed and restored 16,000 implants. In this video, we will discuss important factors such as why treatment sometimes takes 12 weeks, whereas other times it takes 12 months. We will discuss the main goal of all implant treatment, the hidden factors that speed up or slow down osseointegration, what are the 4 stages of dental implant treatment, and finally, the variability of workflows. Our goal is to discern the truth from media hype and present you with scientifically backed information. Your time is precious and your health is invaluable, so thank you for investing your time in us. The dental implant process from beginning to end typically involves multiple stages that can take several months to complete. In the early days of dental implants, the process from start to completion was approximately 12 to 18 months. However, due to scientific research and development, that same workflow can nowadays take approximately 12 weeks. The duration in time that an osseointegration successfully unfolds can vary depending on a number of factors, such as the patient's overall health, their oral health, and the complexity of the case. And any additional procedures that are required will obviously affect that workflow. And we will expand on this a little further in episodes 105 of the Patient Education series. The first step is the initial evaluation and treatment planning phase, which includes dental imaging and consultations and can take a few weeks to unfold. The next step we refer to as first stage, and this is the surgical placement of the dental implant itself and usually is completed in a single appointment. Typically, this takes 1 to 2 hours. By way of example, in my own surgery, the actual placement intervention only takes 15 minutes from start to finish, but we apportion 1 to 2 hours as there are a lot of other procedures that need to be done, including impressions and photographs and color matching, and I like to chat to the patients before and after the procedure, and sometimes I even ask the patients to have a little sleep. And most important, I need to have a good cup of coffee once the procedure has been completed prior to the next appointment. After the implant placement, a healing period of several months is often required to allow osseointegration, as described earlier, to unfold. This is the process where the implant is fused with the jawbone. During this healing period, the patient needs to be provided with a temporary restoration, sometimes, to maintain aesthetics and function. And by way of example, here is an actual case that we've received consent from the patient to demonstrate for teaching purposes. So this is a case where the patient has lost their single front incisor and an implant has already been placed and the patient has been fitted with a 1-tooth partial denture which snugly fits into this area, and they can basically carry on with their day-to-day life as per normal. By way of example, here is another case where a patient has lost a single premolar. This tooth is still in their smile line, and so this patient has had an implant fitted in that position and is wearing a 1-tooth partial denture, which also snugly fits in this area, and they can carry on with their day-to-day life as per normal. The integration of the implant with the bone typically takes 3 to 6 months, although this timeline can vary depending on an individual's healing abilities, their general health, and the quality of the bone. So typically, if the patient is fit and healthy, doesn't smoke, and has a high quality bone, they will routinely have integration of their implant after 3 months. Whereas a patient who has diabetes or is a cigarette smoker, this will take longer. And in my practice, we commonly only bring those patients to test their implants after 6 months to give their bodies sufficient time to heal. At the second stage appointment, osseointegration is confirmed through dental examination, specialized equipment, and imaging. And an abutment is attached onto the implant. This is the connection that sits onto the implant, and this requires typically a short appointment. After the abutment has been placed, once the gum has healed, impressions are taken, and this is called the third stage, to create the final custom-made restoration, the crown, the bridge or the denture, which may take several weeks to manufacture. The final step is called the fourth stage, and this requires the placement onto the abutment, completing the dental implant process. It is important to note that what I have described above is referred to as a traditional workflow, and these time frames are a general estimate and can vary depending on the specific case and the individual's healing processes. There are more specialized workflows that are sometimes performed, and these steps that I've described may be different, and we will discuss this in more length in episodes 12 of the Patient Education series. That being said, the one thing that never changes, no matter what the workflow is performed, and that is the principal milestone of osseointegration. That must always be achieved for successful implant treatment. Working closely with your dental professional throughout the whole process will ensure that the treatment progresses at an appropriate pace and leads to a successful outcome. And I always ask my patients at the outset of treatment if there are any important landmark special social events on the horizon, like a marriage, an engagement, or a photo shoot, so that we can adequately and appropriately plan the treatment around these important social events. If you find our content valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember that the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast, where we will dive into the topic of success rates of dental implants and provide you with valuable insights.